Welcome, Dr. Vera. Welcome back. And Phil, such a pleasure to meet you. And we're going to learn your story in just a bit. In the meantime, doctor, just going to refresh our memories of a lot of people out there. They may know of cataracts, but they really don't understand what the problem is. Can you describe it for us?
Sure. So a cataract is the clouding of the natural lens in the eye itself. And this usually starts in your mid-50s and it gets worse as you get older. And what it is just, you can see in the picture here that the natural lens is clear when you're younger, and then as you get older, it turns into this yellowish, brownish color, almost like a little pebble in the eye that prevents the light from going through clearly. And so the symptoms you can get from a cataract can be a general fogginess or smokiness to the vision, which can cause a blur, or you can have trouble with reading and not being able to see things as well and requiring more light to read. Colors can become faded and images are just not crisp like they used to be.
Right.
And then patients can have trouble with driving because they're getting glare and halos from oncoming headlights and not being able to see street signs very well.
Right, it's so scary. And I know a lot of people, they'll just stop driving at night because they are so frightened. And let's talk about treatment, specifically surgery.
Sure, and so when patients become symptomatic where they're having difficulty with tasks or activities such as driving and reading, that's when we recommend cataract surgery. And cataract surgery has become a very safe and sophisticated procedure with over 3 million being done in the US every year. And it's an outpatient surgery, only takes about 15 minutes to do under some mild sedation. And yeah, that's the sophistication we've gotten to this day. And the procedure is done under sedation and the outcomes are very good. So over 98% of patients get better vision with surgery itself.
Wonderful.
And here you can see an image of a patient that's having had surgery done. The animation shows like there's 2 incisions that are being made, and then we open up the cataract capsule, are able to remove it with an ultrasound probe by breaking up into little pieces, and at the end we put an implant inside the eye, and that's what allows the patients to see very well.
Wow, look at that, in 15 minutes, it's incredible. And Phil, what led you to Dr. Vera and Millen Eye Center?
Well, my wife and I were in a process of moving down from Virginia to the Atlanta area. And on one of the flights, we were looking at one of the flight magazines, and voila, we saw one of the advertisements for one of the better eye surgeons in Atlanta. And Dr. Vera's name was there, so I said, well, let's check this guy out. And that's what led us for us to see Dr. Vera.
And were you having those issues of just slowly over time, over a few years, where things were blurry, you were reluctant to drive at night, those kinds of things that he talked about?
Yes, especially at night when driving, the blurry vision, and especially reading. I was getting to the point where I had to take my glasses off to read up close. So I know something had to be done.
And then what was a procedure like? I mean, we mentioned 15 minutes, so you do one eye on a different day, right?
Yep, we do them a couple weeks apart usually.
Okay. And so you went in, were you apprehensive? Were you nervous?
Yes, most definitely, because obviously I didn't have the surgery before.
Right.
And what was really helpful was the nurses. They made me feel at ease, made me very comfortable during the operation. It wasn't that long at all. And Dr. Vera was telling me what was going on. I was awake. I was aware. So the procedure was painless.
Yeah, I've been to their office before. The whole staff, obviously including the doctors, so professional and caring, and that really makes a difference in how you feel when you're undergoing a surgery that you've never had before. And let's talk about his recovery. To you, or you said most patients are seeing again within days?
Yeah, and the recovery is pretty quick for most patients. Within a day or so, you're able to see. While the first day or so, your vision may be blurry or feel a little scratchy. And a couple of precautions we talk to patients about is keeping the eye clean so that you don't get any kind of dirt or germs in your eye itself, and then also making sure that you don't lift anything heavy because you don't want to put inadvertent pressure on your eye itself. But beyond that, you can resume your normal activities within a day, and a lot of people go back to work within days itself after the surgery.
And were you seeing so much better, literally, miraculously, like you said, within days?
Yes, most definitely. I mean, obviously you have eye drops, and to help the eyes and things of that nature. But after a period of time, it was unbelievable. I mean, especially driving, I don't need glasses. Doing chores, don't need glasses, and the one thing was I couldn't wait to go down to driver services to get that corrective lens off my license plate or license.
Oh, that's awesome. And then any advice for anybody who just wants to, do this, but maybe they're putting it off because they are apprehensive?
Well, I mean, I would strongly recommend it. There's no question about it. You don't have to worry about the glasses, and it just, I don't know, it just makes me feel better.
Yeah.
And Phil had the unique situation where he had been wearing glasses for 30, 40 years because he was nearsighted and had stigmatism, and we chose a lens that allowed him to get rid of those glasses and be able to see things not only far away, but also give him some vision for up close, and so now he's able to function and do a lot of things without glasses.
How wonderful. And let's talk about the fact that you can serve people who actually work, Monday through Friday, they're busy, and now you have an opportunity where they can come see you on the weekend. So tell us more.
Yeah, we just started offering a Saturday morning clinic for patients who have cataracts or want to come in for a LASIK consultation on those days itself in our Marietta and Cumming offices.
Good. That's so helpful. And you also have a great special for Atlanta and Company viewers, so tell us more about that.
Sure. So anybody who calls us in the next 24 hours, we're offering $500 off of LASIK.
That's great. $500 off. You just have to call in the next day, but that's a fabulous deal, a fabulous special to get your vision back and get you feeling like your old self, and make sure everyone knows exactly where you're located. You have several.
Yeah, we have 5 locations currently, and we're opening a 6th one coming soon. So we have locations currently in Johns Creek, Cumming, Beaufort, East Cobb, and Canton, and our newest location is going to be in Alpharetta this upcoming December.
Terrific. Congratulations. Thank you so much, as always, for being here. And Phil, I'm so glad you're seeing more clearly and you're really enjoying things now. So thank you so much.
Thank you.
Thank you.
For more information, simply head to MillenEyeCenter.com. That's MillenEyeCenter.com.